Namaste and warm greetings from India to all the readers and the team of Bispectrum who have been instrumental in spreading the good word in the field of medicine. And today I'm here to share with you the vision of our medical college, which has been just inaugurated by the Prime Minister of India and dedicated to the service of the nation. This first of its kind medical school, Sri Madhusudan Sai Institute of Medical Sciences and Research, which is located in a small hamlet called Mudenhalli, about 40 minutes drive from the Bangalore International Airport, is all set to give medical education at absolutely no cost to the aspiring students. As we all know, in India, medical education is a kind of elitist affair, and so it is in most of the countries of the world. And owing to large infrastructure, large number of faculty, and the cost that is involved of the teaching hospital as well, most of the private institutions in India, they offer this education at a very high cost, which many students cannot afford. And in the last few years, we have noticed that despite the government trying to open many medical colleges in India and increase the number of seats available for the undergraduate and postgraduate program, the demand for medical education is so high that it's 10 times the number of seats that are available. And that's how many of the students who could become doctors are unable to avail this education. While this country is so populous, and you know that India lives in its villages, even today 60 to 70% of Indians live in small towns and villages. And that's where all the help is needed when it comes to medical infrastructure and services. The institute has been granted to take 100 students every year as per the requirements of the National Medical Commission. Whatever criteria we meet, that has allowed us to take 100 students a year. But I have been of the opinion that I need to take lesser people in the first 1 or 2 years in order to make the culture of service and inspiration sink into the young minds of the going to be medical professionals. So we have been asking the government to give us lesser seats, maybe 50 seats to begin with, and after 2 or 3 years we would like to go to 100, 150, and that's how it would increase. As per the National Medical Commission's regulation, there are 27 odd departments which need to function within the institute, and year after year the faculty is added. So we begin with around 108 faculty across various departments. The first year or two will have lesser departments which are functional in terms of providing the education, while the clinical work still goes on in all the departments. But we increase the faculty over a period of time, and that's exactly as per the syllabus and the course curriculum designed by the National Medical Commission, which regulates the medical schools in India. Even before we started the medical education program, we had started the paramedical program and also nursing, because we truly understand that a doctor cannot function all by himself without the support of the technical people, the paramedical staff, and most importantly, the backbone of every hospital, the nursing department. So we started that last year, and even in this medical course curriculum, we have come up with some innovative ideas to make it more applicable, more practical for the students as well as the patients who are going to be treated by these students in the future. So we have a village adoption program too, where the students are sensitized to the need of the Indian villages, the rural communities, and they are going to be adopting one family each from the very beginning and look after those families all through their education. And this is how we are trying to build the connect between the medical professionals and the rural communities which they are going to serve in the future. Also, we are trying to incorporate some of the evidence-based findings when it comes to certain aspects of Indian medicine, which is can be as simple as doing deep breathing like pranayama, which releases the stress and also makes people more less anxious and more comfortable. And many such innovations are being brought in. But definitely all these is going to be absolutely scientific based and completely evidence based curriculum. We also are hoping that our students will be able to do some exchange programs and internships with renowned medical institutions from around the world that will help them to get a good exposure to the kind of cutting edge research and the work that is going on in many institutions in India and abroad. So far as it concerns the investments in the infrastructure, as well as there is a operational cost of these institutions as well, because we are totally free. We run the hospital. We have been running it for the last 5 years here, and the operation costs also are borne by the trust, and we do not charge the patients at all. So largely the investment would be the capex, which is the infrastructure, and the opex, which is the operational expenditure. And so far we have spent in Indian rupees close to around 400 crores in building the infrastructure and on the operational costs. And in the future we are going to spend a similar amount or maybe a little more as we expand the number of beds as per the requirement of the National Medical Commission and increase the number of seats. Also provide the residential facilities for the staff as well as the students. All this would entail another probably 400 to 500 crores of investment in the coming years. Many people have expressed their concerns about the sustainability of the institutions because they're absolutely free and there is no other source of income other than the donations or endowments that we receive from like-minded organizations and individuals. So to them I want to say that yes, we definitely need all the support in the world, and anybody who feels that medical education or any kind of education must be made available to the deserving students as a fundamental right without any concerns of cost and finances. I think this is the platform where they can join hands with us and make it a reach to more and more deserving children.